Alright, go. So this is the isometric exercise for the supraspinatus. The exercise is considered isometric due to the fact that there's a static hold. There is no change in joint angle or muscle length. The wall or the athletic trainer can provide resistance to allow a static hold. Length of hold set reps can be two sets of 10 with a 5-second hold on each. Patient will be moving into the empty can, open kinetic chain portion of the exercise. Athlete stands with scapula retracted, shoulders depressed, with thumb pointing down. The athlete should be bringing shoulders to a 30-degree angle and raise his arm. This can be done for three sets of 10 and can also be altered based on where they are in the rehab process. Concentric portion would be them raising their arm, and the eccentric would be them bringing their arm back down to the starting position. Poor habits to be aware of would be shoulders that are protracted, poor posture. These are things that should be be made aware of to the athlete. Verbal cues would include keeping shoulders retracted and depressed, proper posture, head straight ahead. Athlete will now move to slide board TheraBand wall slides. Let's sit down. So athlete is now moving to slide board TheraBand with wall slides. This would be a closed kinetic chain exercise. Athlete begins on all fours, shoulders directly under chest. Thumb of affected side should be pointing towards opposite knee. Athlete should bring thumb to knee, then back out. This can be done for three sets of 10 and can also be altered based on where they are in their rehab process. Concentric phase would be athlete bringing their hand away from the knee, and eccentric will be bringing their thumb towards their knee. AT should be aware of the patient's hips not dropping. Elbows should be locked into extension. Patient should not demonstrate any other signs of compensation. Poor habits to be aware of would be hip drop, slight flexion of elbows, increased involvement / compensation of upper body. Next, patient will be moving to weight ball underhand backhand toss. This would be the functional exercise of the So with athletes standing, they should be demonstrating correct posture, scaps retracted, depressed, head straight ahead. Thumb should be pointing down, and athlete tosses ball to the side with affected arm, then catches the ball. This can be repeated 3 sets of 10 and can also be altered depending on where they are within the rehab process. Concentric would be the initial toss of the ball, and eccentric would be returning to the starting position after catching the ball. Poor habits to be aware of would be poor posture, retracted shoulders, forward head, any other involvement or compensation that would alter the exercise.